Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hey everyone, today we're going to talk about Vengesic. The name might sound a little complicated because it combines phenylbutazone, dexamethasone, methocarbamol, and aluminum. Don't worry, I'm going to explain everything you need to know. Vengesic is mainly used to treat problems that cause pain and swelling. For example, arthritis, muscle spasms, and some allergies. If you've ever had severe joint pain or muscle spasms, you might be prescribed this medication. So how exactly does it work? Phenylbutazone is an anti-inflammatory, which means it reduces pain and swelling. Dexamethasone is a steroid that helps to lower your immune system's response. Methocarbamol is in charge of relaxing your muscles, and the aluminum helps protect your stomach by neutralizing stomach acids. About the dosage, it's super important to follow your doctor's instructions exactly. Normally, you start with a higher dose, and then it's lowered to a smaller dose for maintenance. Never take more than what you've been told. Let's talk about side effects now. You might experience stomach pain, dizziness, or drowsiness. It's also important to be aware of any type of allergic reaction. And remember, you shouldn't take Vengesic if you have an active infection. In short, Vengesic can be a big help in controlling pain and swelling, but it's essential that you follow your doctor's recommendations and that you keep in mind the possible side effects. If you have any questions or concerns, don't hesitate to talk to your doctor. Thanks for watching this video. See you next time.
If you've made it this far, let us know in the comments why you're using this medicine.